Naamit Gerber. I'm a radiation oncologist at Perlmutter Cancer Center. I treat breast cancer and lymphoma. One of the exciting things in early stage breast cancer is we're really trying to find ways we can de-escalate treatment for women and trying to figure out who needs less treatment and who needs more treatment. And along the former lines, we have a very robust partial breast program at NYU, where we give women 1 week of radiation for early stage breast cancer, this specifically for postmenopausal women. And so what 10 years ago even was 6 weeks of radiation has now been reduced to 1 week. And we use a lot of cutting edge technology to deliver this radiation. We use CAT scans on the machine, and it really is a game changer in terms of the risk-benefit ratio of radiation because of both the logistics of the treatment, that it's only 1 week, and also the wonderful outcomes. Many of the patients we see have disease that has spread outside of the breast, and radiation plays a really important role there in helping with pain, and that's something that I derive a lot of meaning from, seeing patients at different stages of their disease and really being able to help, even when our intent isn't necessarily to cure the cancer, get rid of the cancer. Radiation plays a really important part in helping patients at that advanced stage of disease as well. In terms of how radiation is used on lymphoma, historically radiation was the curative modality for lymphoma, and then thankfully as chemotherapy's gotten better, radiation use has become less prevalent in lymphoma, sometimes not at all, and sometimes in combination with chemotherapy. But as chemotherapy has become more widespread, some of the important indications for radiation have been lost. So there are some patients with Hodgkin's lymphoma, for instance, those with bulky disease, who very much need radiation. So it's really important in those cases to have the conversation about the advantages and risks of radiation and whether or not it's important. And that's something that we do as a multidisciplinary team here at NYU. And then there are other forms of non-Hodgkin lymphoma, such as early stage follicular lymphoma, where radiation similarly is the single curative modality. And thankfully, lymphoma is very radiosensitive, so we're able to treat to a very low dose with very few side effects.